Tippecanoe County to take common sense steps to prepare for the possibility that coronavirus will continue to gain a foothold in the United States. Coronavirus is thought to be spread mainly between people in close contact within 6 feet of one another when an infected person coughs or sneezes. Symptoms include cough, fever, and shortness of breath. We realize this can be alarming by the information you hear regarding the virus. Caution is appropriate, preparedness is appropriate, and protecting yourself and your family is certainly appropriate by practicing the following steps. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, mouth, and face with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. At this time, Indiana has no confirmed cases of coronavirus. ISDH continues to test for coronavirus presently and continues to work with local health departments to monitor any suspected cases. As the CDC continues to state, the risk to the American public remains low. The Tippecanoe County Health Department, in conjunction with our public health, public safety, hospitals, and Purdue University partners, continue to review plans that are in place. The State Department of Health continues to work with state, local, and federal partners to refine existing pandemic response strategies, which include specific measures to prepare communities to respond to local transmission of the virus. We are asking that the public trust medical professionals and not social media. We're asking that the public stop buying N95 masks. Our first responders need them. Individuals that show symptoms need them to curb the spread of the disease. Masks are for sick people only, not for well people. Trust what the CDC puts out in their recommendations. We are also asking employers to begin reviewing their sick policies. And we are asking the public to avoid visiting emergency departments unless you have significant symptoms such as fever, cough, or shortness of breath, and/or risk factors for coronavirus. And please be confident that every local elected official, healthcare professional, public safety personnel in our county is giving this the fullest amount of attention possible until the situation resolves. Thank you for your time.
Is it possible for someone to be infected with the COVID-19 virus and not realize it? And what are the symptoms? They just don't know they're sick, but they're carrying it?
Yes, so the symptoms of coronavirus are fever, cough, and shortness of breath. The World Health Organization has stated that the spread of the illness by asymptomatic people, that is people who don't show symptoms, has not been a major factor in coronavirus.
Is there test kits here that we have?
Testing is done through the Indiana State Department of Health and the CDC. So people can be tested locally, and then those test specimens are sent off for testing.
You guys do have testing kits here in Tippecanoe County?
What we have is the ability to swab people for it, and then that swab is sent off to the State Department of Health or the CDC for testing.
Have you done that? Swabbed people and sent things to be tested?
There have been some individuals tested in our community, yes.
Do you have a number of how many?
No, I do not.
Tested for COVID-19?
Correct.
For the 3 students who came back from Shanghai tested?
Go ahead, Kayla. Sorry.
What's happened to those people while you're waiting for the test results to come back?
Those people are instructed to isolate at home until the test results are returned.
And how many are we talking? Are we talking dozens, single digits? How many tests are we talking about?
Have been tested here locally?
Yes.
Single digits.
Are all the students that came back from China, have they been released to go to class, those kinds of things?
As far as I know, yes.
How about anybody else in the community, anybody else under quarantine right now, or anything self-quarantine right
There are individuals who have traveled from areas of the world where coronavirus is more prevalent, who are under a self-quarantine monitoring period. Yes.
Say there was a quarantine in Tippecanoe, what would that look like? Where would that be? Would there be like a certain area that you guys would have quarantined off, or what would that look like?
Well, probably what would most likely be the case, because this is what has happened with other infectious diseases, is that those quarantines would occur in people's homes when possible.
A person who's sickened by COVID-19, assuming they survive, as the majority would do, how long is the treatment and what is the treatment?
So the current treatment for coronavirus is supportive care. There is not a specific antiviral medication. So the treatment, of course, depends on the severity of the illness, but can range anywhere from the basic supportive care measures that one would use when one has the cold or the flu, all the way up to hospitalization, which would include oxygen, IV fluids, other sorts of general medical support.
How long does it last?
The illness can last anywhere from 1 to 2 weeks.
And how long are you contagious?
That information is currently not known. There is a incubation period of up to 14 days, but what's not known is if somebody who actually has the illness, how long would they be contagious for?
How long did it take to get the COVID test results back from the time they were swabbed? I assume, I don't know precisely if they use blood samples or swabs, but how long did it take from the time of the test to getting results?
It's usually 24 to 36 hours.
Is that what you experienced here?
Mm-hmm.
What prompted you to hold this, address the public this fall?
Well, in the last week, there's been an increase in cases in other parts of the United States. Again, there are no confirmed cases here in Indiana, but we felt that with this increase in cases and the potential for there eventually being cases here in Indiana, we thought it was a good idea to take this next step and to inform the public that we have been preparing for this and are currently working with our community partners to help ensure the safety and well-being of our community.
If someone has symptoms and you're saying don't go to the hospital, what should they do? Who should they notify?
Sure.
Call their primary care? Or?
Sure. So individuals who have severe symptoms should go to the emergency department, okay? Individuals with milder symptoms should contact their physician or go to the urgent care center.
Is the department concerned about students traveling for spring break and returning in late March?
There is a concern about that. Certainly, we would agree with the CDC about the advising against travel to certain parts of the world that are experiencing coronavirus. Travel within the United States currently is not restricted. So we're hoping that there are no issues because of spring break travel.
Should students consider changing the plan to see like driving instead of going on airplanes or staying airports?
I think that it really depends on your destination and where you're going.
Would you recommend or would you take action with Purdue and other organizations up here saying, if you leave the country, if you go to a place where there's a high incidence of this virus, when you come back, plan on being quarantined for 2 weeks and tested?
That would be consistent with what the CDC is recommending. Yes.
So since there have been cases of an unknown origin in other parts of the country, is that anything you guys are worried about in Indiana? Is that why you guys wanted to, send out this information or address the public?
Certainly the appearance of what's known as community spread of the illness, that is cases where there's an unknown source, certainly catches our attention, and of course heightens our awareness of what could potentially happen anywhere in the United States.
What about the public schools right now? What is the health department doing with the schools? If they-
So we have a representative from the health department who will be meeting actually with the school safety committee within the next week to finalize and continue those plans for coronavirus.
So piggyback off of that, with the kids' athletics coming up, soccer, baseball, you're saying within 6 feet. How is that? How does that pertain to us as parents?
So right now, there is not a recommendation from the federal government, state government, or from us about distancing oneself socially. And so at this time, there should not be a concern about sporting events.
I'm not clear, on the people who were tested here, why were they tested and have all the test results come back?
These would be individuals who would have been tested because they met the criteria for testing. Those criteria have changed as the weeks have gone by. So initially, these were individuals who had symptoms consistent with coronavirus, but had also been in an area where coronavirus is problematic. And so that was the reason for testing these individuals.
So what are the guidelines now?
So the current guidelines, which are changing frequently, include not only symptoms, but also close contact with a person known to have coronavirus, or recent travel in a geographic area where coronavirus is prevalent.
You mentioned asking the public to stop buying masks. Are you experiencing local problems getting safety equipment for your first responders?
I have heard that supplies are running short for masks and other medical equipment, and I think that's happening nationwide.
Has there been any talk, I know you're talking about with the schools, but if the schools, what would it take to have the schools have to close? And if that were to happen, this came up at a city council meeting. If that happened, what would you do about like free and reduced lunch, things that families depend on schools on besides just where their kids go?
Sure. So the schools have their own policies and procedures about closure due to any sort of illness or other contingencies. The schools also do have plans in place for those other issues, and so we would rely on the systems in place to help with those issues.
Is our community any more at risk of getting this because we do have so many people from other parts of the world that study here and then travel outside of the country for seeing family, etc.?
Well, I think certainly international travel, particularly the parts of the world, does carry with it an elevated risk. We're not the only community in the U.S. that has a large international population. Say, for example, Chicago has had just 4 cases of coronavirus, and that is a very large metropolitan area with people from all over the world traveling there quite frequently. And so I think that while there is some increased risk here, it is not a significant increase.
What happens if this extends into like voting season? Voting season, that's just around the corner. What's do you guys have a protocol in place for that? Like, I mean, what if people are quarantined and they, obviously they still have right to vote? How would you address that? Is it something
Yeah.
we have to figure out in the future, or?
I think that would be an issue to be worked on with the Board of Elections and coming up with plans for alternative means to vote.
What specifically, you say community partners are doing things right now. What specifically are they doing, and when should we start hearing from them about what that would be?
Yeah, so All of our community partners have a lot of experience dealing with various health emergencies and health problems. They have plans in place, just like the health department does, and those plans are being modified to accommodate for the coronavirus. So we at the health department have met with those community partners, and we feel confident that their level of preparation has been very good. As to answer your question about when you'll hear from them, I think you'd have to ask those partners directly.
But senior communities, are you asking them to do anything special to limit visitors, kind of like we see with the hospital?
At this time, we're asking that they follow the same procedures that they already have in place for other influenza-like illnesses.
Are you guys being overrun, and do you know that the hospitals are being overrun with people coming and saying, I have a cough, so I must have coronavirus? I mean, do you see, what kind of situation is it for the health community trying to manage this right now?
I have heard that the emergency departments have seen a fair share of people who are concerned about it. And so I think that, of course, can put a potential strain on our system. And that was the reason for my statement about not visiting the emergency department unless you are severely ill or exhibiting significant symptoms.
If you do have any, say these single-digit individuals who are being, tested for coronavirus, if they do come back as positive, will you have another press conference like this to address it, or how will that information be sent out to the public for them to know how to keep safe?
Sure. Yes. We would definitely have another press conference. Absolutely. Yeah. Okay.
When would we know if there is something that's considered an outbreak? I'm getting the sense from today is this is more precautionary.
Yes.
Discussion today. When will we know, or would we know, that yes, we're at a point of a certain number that we're concerned about, and it's an outbreak or it's a heightened level?
Sure. Yes, today is just precautionary. That is correct. As I said, we would be holding a press conference if and when there ever is a confirmed case, and then from there we would be informing the public and the media of our total case numbers as the disease progresses, if it does.
So we would know if there was one case in the county, what was going on. There's no 0 to 5 kind of rule in that case. We would just know that one case. Okay.
Yeah. Yes. Okay.
Is there any status on the vaccine?
I've heard reports of vaccine development. I don't know, though, how far along in the process that is and what the time frame is. Typically, it takes quite some time to develop a vaccine and get it manufactured and available to the public. But I don't have a specific time frame that I could give you on that.
Any concerns in close quarters for the sheriff, for the jail, or for Purdue with dorms, or is there anything along those lines with places where you can really get away?
Yeah, what we're working on now is making sure we have things to keep everything disinfected, making sure our staff understands if you're sick, don't come to work. We understand we have to work with less people than normal, but we're working with our medical care provider right now to see what they're doing, what precautions they're taking across the state and the other facilities that they have.
Thank you all for attending.